Now to a breaking news alert. More U.S. families are saying no to vaccines for kids. According to new data from the CDC, kindergarten vaccination rates inched down again last year, and the proportion of children with exemptions rose to an all-time high. The fraction of kids exempt from vaccine requirements rose to a new all-time high of 4.1%, up from 3.3% the year prior. It's the third record-breaking year in a row for the exemption rate. And News 2 is digging deeper into the debate over public health versus personal freedom. Earlier today, we hosted a town hall with medical experts. They addressed the concern that vaccines cause autism, with one viewer asking about the use of heavy metals in vaccines. Dr. Creech says this is a rumor that's been around for decades.
The challenge is we don't know all the things that contribute to autism. We simply don't know why some kids develop it and some kids don't. What we do know is that the most common age of diagnosis is shortly after the first birthday, which is in close proximity to when children get their MMR vaccines. But I also want to caution us to say that just because two things are related, it doesn't mean they cause each other. So even though children are getting MMR around a year or year and a half of age, and that may also be the time that they have an autism diagnosis, we need to be careful about putting those two together. So for instance, if you want to see something that links to autism perfectly on the graphic scale, organic food sales perfectly correlate with the rise in autism. I don't personally think that organic food sales cause autism, but the correlation is perfect. Or another one is that if you look at the stork population in England and you compare that to the birth rate, we see that as the stork population goes up, the birth rate goes up. And when the stork population goes down, the birth rate goes down. Now, I don't think storks deliver babies. But in the UK, you could make that assumption if you just look at it that way. The other part of the question that's very sophisticated is this blood-brain barrier issue and the heavy metals. So first off, we don't put heavy metals into the vaccines. Thimerosal was a preservative, and it's different than the mercury that you might remember from Alice in Wonderland and the Mad Hatter. We do have aluminum salts that are in some vaccines, but not all vaccines, because they help us use very little of the actual antigen, and it allows us to tell your immune system to pay attention to what we've now trying to train you for, so that when you see the real thing, you can respond appropriately. What's really important is the blood-brain barrier, which prevents certain things from getting into the brain. It's actually very effective at preventing any number of things from getting in there, except that which needs to be in there. So we really see no data in either small animal models or in human studies that would suggest that anything untoward is getting into the brain in any kind of a toxic way. And study after study after study in the US, in Europe, and across the world would say there is no connection between vaccines and autism.
And you can watch the entire town hall right now on WKRM Plus. It's free on Roku, Fire TV, and Apple TV. And we are taking a look at how Tennessee is shaping vaccine policies for children all day today. Coming up on News 2 at 4, we learn how language can act as a barrier to kids seeking health care.